Dr. Darien joins us. We're going to put you to real work, though, now. You're looking at a medical question from one of our viewers here. Savannah B. asking, can I consume alcohol when taking an antibiotic like amoxicillin?
I love questions like this because when I'm talking to patients after prescribing them antibiotics, I'm often having this conversation. The short answer is not every antibiotic do you have to avoid alcohol, but the long answer is I always encourage avoiding alcohol with all antibiotics for two reasons. One of them being that some antibiotics, for example, Flagyl, something I prescribe often for things like diarrhea, can increase the risk of something called a disulfiram reaction, which basically translates to making your hangover horrible. And so I always tell patients, if you choose to drink while you're taking this medication, you're going to wake up in pain. The second reason is absorption. If you're drinking alcohol, you're not absorbing that antibiotic at the level you want, which can increase the risk of recurrence and prolonging your infection.
And dry you out even more.
And dry you out even more.
Also, aren't you sick? Shouldn't you be resting?
You know, I try to remind people about this, but you'd be surprised, even in sickness, people are asking those questions.
All right, your prescription for wellness.
Let's stick to antibiotics. So what you need to know when you're prescribed antibiotics, many people don't realize that there are a variety of antibiotics, hundreds of different types for hundreds of different infections. So the first thing you want to make sure is to take your medication as prescribed. That means you want to take the full course of antibiotics, even if you start feeling better, because if you stop early, that increases the risk of possible recurrence and increases the risk of antibiotic resistance, something we're trying to combat each and every day. Also, check with your pharmacist to make sure when you can take the antibiotic and also what you can take it with. I always encourage drinking it with water, sometimes with food with certain antibiotics, but you want to avoid fruit juices and other things that might decrease the absorption. Also, watch for side effects. Diarrhea is very common with antibiotics, and that also subsides with time, so that's not something that I worry about too much, but changes in skin patterns, rash, wheezing, this can be a sign of an allergic reaction, for which I'd recommend stopping and contacting your medical provider. And then don't save, this is important, don't save these medications for later use. I know that this is the most important point about this, because I can tell you that if I go into medicine cabinets, and I won't hold you too accountable, I can find some old antibiotics.
And if I don't feel well, I'm like, maybe I should just
exactly what happens. You want to stop doing that. You don't know if that antibiotic is appropriate for when you don't feel well again, and also expiration dates exist. So
also, as I was judging about the drinking, I was like, I've definitely had a drink on antibiotics.
And in the holidays, you'd be surprised. I think a lot of people are doing the same.
FOMO.
Hopefully,
right, listen to the doctor.
Yes.
All right, Doc, thank you. And
of course.
Folks, if you have any questions for our doctor here, Dr. Darien, just hit us up on Instagram with all of your medical questions at ABC GMA3.
I just wanted to keep it real. I keep the judgment for myself.
You got to keep it real.